Justice in Healthcare, presented by Lindsay, Megan, Jen, and Elena. Justice in healthcare is the fair and equal distribution of resources and responsibilities that have a positive outcome on an individual's health. JEM will be exploring justice in 3 categories: through lecture, volunteering on Boyle Street, and through clinical at the Grace Hospital.
Today, JEM is going to her health studies class to learn about discrimination in healthcare. JEM is learning about how discriminatory messages are frequently encoded non-verbally. These messages may be communicated without conscious awareness, so it is important for nurses to pay attention to their actions and adjust their behaviors towards patients if necessary. Patients who have experienced discrimination in healthcare settings might try to avoid health services, which can have detrimental impacts on their state of health and can lower patient self-esteem. It is important for nurses to know about ways in which they can reduce discrimination so that patients' goals of care can be met without interference. Education about the determinants of health will allow nurses to understand patients' backgrounds, which can encourage nurses to take a holistic approach to care. It is important to have an open mind and to adjust ways of communicating to allow for more pleasant and efficient interactions. Focusing on positive messages will allow patients to feel capable and will remind them of their success. Sharing a patient's strengths with them will encourage self-awareness. Reflecting on the reasons for why we do the things we do is an important method to get a better understanding of the outcomes that result from our actions. Discrimination results in inconsistent care being provided to patients and prevents patients from having positive outcomes. By asking her teacher questions for clarification and listening, she learned that discrimination in the healthcare setting can result with clients not receiving proper medical care and not maintaining patients' dignity. JEM learned how to reduce stigma that interferes with positive patient outcomes. With a new understanding about the inequalities in healthcare, JEM will be able to apply this information during her clinical practice.
JEM is volunteering on Boyle Street today, serving and preparing high-quality meals to community members affected by poverty and homelessness. JEM meets Maurice. He tells her a little bit about the factors, constraints, and barriers to care that he faces as a homeless man. Maurice engages JEM in conversation and tells her a little bit about himself. Maurice tells JEM about the social determinants of health that affect him. Maurice tells JEM about the discrimination and stereotyping that he faces as a homeless man. JEM is very sad to hear this. She says goodbye to Maurice and goes home for the day. JEM learned that health inequalities are influenced by social factors such as income, employment, education, and social connectedness. While volunteering on Boyle Street, she learned about the services that Boyle Street community provides. Today, JEM also learned that increasing the accuracy of impression contributes to successful interpersonal communication.
Today, JEM goes to clinical at the Grace Hospital. When she gets there, she is surprised to find a familiar face. JEM quickly goes over to say hello. JEM is excited to see Maurice from Boyle Street again, but she is concerned that she is seeing him at the hospital as a patient. JEM begins to assess his vitals and get a health history. JEM has to go and check on other patients and lets Maurice know that everything looks good, and she will be back in a little while to check on him. While John is gone, Maurice is waiting by his bed while he overhears some of the staff having a conversation. The hospital staff are complaining about Maurice's hygiene and don't want to help him because they are disgusted by him. This makes Maurice feel very ashamed and upset. When John comes back, she notices a change in Maurice's mood. Maurice is reluctant at first, but eventually tells John what he overheard and how upset he is by it. John is shocked to hear what has happened, but she keeps this to herself as she listens to his story. At the end of the day, John is still troubled by what happened. As a first-year nursing student, she is unsure what she should do. John decides to talk to her clinical instructor about what happened. What John doesn't know is that this is not the first time her instructor has had this issue brought to her attention. The instructor talks through John's feelings, letting her know that she did the right thing, and that this can be a very difficult situation to be put in. John's instructor noticed this is a recurring issue at the hospital and decides to arrange a sensitivity to marginalized populations course with the hospital staff. As part of the course, the staff visits Boyle Street, raising awareness about homeless populations. The instructor knew that she could easily have advocated for one individual, but it would be far better to address the issue systemically amongst the hospital staff to help prevent future prejudice. Advocating for patients is an important part of being a nurse. The patients nurses care for can't always speak for themselves, and being in a hospital can often be an intimidating and overwhelming experience as a patient. Advocating for patients isn't always easy, especially as a student nurse. John learned how to advocate for a patient when she approached her teacher concerned that her patient was not being treated with respect or dignity because of his socioeconomic status.
Here are some things to consider before addressing discriminatory comments. When you do decide to stop discriminatory comments, here are some helpful tips to follow. So why is it important to know this? Well, nurses work at the front lines of the healthcare system. They face the impact social factors have on groups of people and individuals. Nurses have a better understanding which groups of people and individuals are most susceptible to illness. Even if nurses know about social factors, many nurses feel powerless to address them. In order to get others to understand the impact of social determinants of health on individuals, nurses need to advocate for individuals' equity in healthcare. As nursing students, we can help to address these issues by advocating for our patients, performing detailed assessments on our patients, being mindful, and by communicating effectively both with our patients and with other healthcare providers. As nurses, we need to challenge people's conventional ideas about poverty, social justice, and equity. It's important to understand that social determinants of health are not individuals' issues, but structural ones. The training of healthcare professionals in the community can help increase awareness and sensitivity to marginalized populations. It also provides opportunities for growth and collaboration, leading to a more mindful and compassionate healthcare team. In conclusion, the concept of cultural safety is intended to shift healthcare practices to explicitly address inequitable power relations, institutionalized and interpersonal discrimination, and ongoing impacts of historical injustices on health and healthcare.